We want to thank everyone for joining us this afternoon as we discuss the COVID-19 vaccine booster shots and third doses. The Boone County Health Department is here joining us today to provide you with the most up-to-date information about who should and who can receive these follow-up shots. I'm Pamela Lopez Fettis, Executive Director to Growth Dimensions, and we're the economic development arm for Belvidere and Boone County. And just some quick housekeeping notes. Today's attendees will be muted. We will hold a question and answer period following the presentation where you'll have the opportunity to direct your questions to the health department. We're also recording today's event and we'll be able to make it available on www.forwardboone.org. And for those of you that are new to Forward Boone, let me share with you a little bit of history and how we came to be. The group of partners listed on this site have begun working together in April of 2020. And we've started beginning to bring local leaders together to combat the impacts of COVID-19. And as partners, we understood that we are stronger as we work together. And as you can see, Forward Boone is a very diversified list of organizations involved and dedicated to Boone County. And it's also my pleasure to introduce to you this panelist who has been involved since the very beginning of our initiative of Forward Boone and with the Boone County Health Department. And featuring today's Forward Boone is Amanda Meal. She's a registered nurse and has a master's degree in public health. Amanda earned her bachelor's in administration from Beloit College and her MPH from the University of Illinois, Chicago, as well as her associate in science and nursing from Rock Valley College. Amanda is academically and professionally motivated to address the population health at a local level. She has worked in public health for over 16 years and currently oversees the operations of the Boone County Health Department in Belvidere, as well as their public administrator. We also have Ellen Genrich, who is our emergency response coordinator for the Boone County Health Department. Ellen has led the Boone County Health Department's response for the H1N1 pandemic and currently heads up the response for the COVID-19. She has completed her professional development series for the Illinois Emergency Management System and has been with the department for 21 years, 15 of those years as a current role as emergency response coordinator. And last but not least is Emily Morales. She's a COVID-19 health response staffer for the Boone County Health Department, where she helps mitigate the impacts of COVID-19 pandemic. She is a current graduate of and research assistant for the University of Illinois in Chicago, and with their Chicago's School of Public Health, concentrating her studies on environmental and occupational health. Without further ado, please join me in welcoming our panelists. Thank you.
Great. Pam, thank you so much for that warm introduction, and welcome everybody who's joining us in the forum through Zoom and everybody who's listening live on Facebook. We're so glad to have you. I'm Amanda Meal with the Boone County Health Department. I'm going to jump right into the meat and potatoes of our presentation, but I first want to give a very important shout out and kudos to my colleagues who are joining me from my team here. Ellen and Emily are the brains behind all of our mass vaccination efforts. They work tirelessly, putting in extra hours at night and on the weekends, and they are making these mass clinics happen. So without their capable hands and hearts invested in not only the rollout back earlier in 2021 when we began doing vaccine for the first time here in our community, to now that we're doing our third doses and our boosters, we could not be where we are today without their tireless efforts. So please join me in thanking them on all of their hard work. So let's talk a little bit about the differences between third dose COVID vaccine and booster dose, because there are some differences. I know that there's been some confusion and some questions, and we want to make sure that we're being really clear with our community so that they know what to expect. So third doses, CDC is now recommending that people whose immune systems are compromised moderately to severely should receive an additional dose of the COVID-19 vaccine after the 2 initial doses. These additional doses should be administered at least 4 weeks after a second dose of the Pfizer COVID-19 vaccine or the Moderna COVID-19 vaccine. So Johnson & Johnson is currently not eligible for what would be a second dose, but at this time there is no additional dose recommended for Johnson & Johnson. It is not a booster shot, these third doses, and these are not intended for general community members. And we'll talk a little bit about what specific immunocompromised conditions qualify for a third dose. Our department has been offering third doses now since the very last week in August, and we will clarify for you later in the presentation exactly where you can go to get a third dose. Today, we're really excited to announce the kickoff, which will start next week, of our booster dose clinics. So we will be standing up mass vaccination clinics for booster doses, and this is a supplemental dose that's given to people who have a vaccine immune response that has weakened over time. So this is a much larger population of people within our community, and we'll clarify exactly who qualifies here later in the presentation. And this dose may be different than what people first received. So as of right now, just to be really clear, the only vaccine that has been approved for booster shots at this time is Pfizer. So third dose recipients can be Moderna or Pfizer. Booster dose recipients are only Pfizer at this time. We do believe that Moderna will follow suit here soon. We don't have an estimated rollout for that. So if you're on the forum today, or if you're listening live on Facebook and you received 2 doses of Moderna, please stay tuned, as our department will be sure to give more information in the coming weeks to months as to how you might be able to receive a booster once that is authorized. Next slide. So I mentioned already that those third doses can be administered at least 28 days after receiving the second dose of the 2-dose series of Pfizer, which is for 12 and over, or Moderna, which is for authorized for 18 and over. The third dose should always be the same vaccine brand that was received for the first 2 doses. If for any reason you're not sure what vaccine brand you received, our Illinois Eye Care and Immunization Registry is a lookup system where our trained staff can double check for you to find out exactly which brand you had, and then we can direct you further so that you know exactly what you qualify for. In order to receive that third dose, the person must self-attest to currently having one of the eligible conditions. Next slide. So the eligible conditions for a third dose are having been receiving active cancer treatment for tumors or cancers of the blood, received an organ transplant and are taking medicine to suppress the immune system, received a stem cell transplant within the last 2 years or are taking medicine to suppress the immune system, moderate or severely primary immunodeficiency, such as DeGeorge system or Wiskott-Aldrich syndrome, advanced or untreated HIV infection, or active treatment with high-dose corticosteroids or other drugs that may suppress your immune system. So what we're doing here at our clinic, and what I have heard is happening out in the community with some of our pharmacy partners and our primary care providers and clinics in town, is that they're double checking with you to see if you fall under one of these categories, or if it's your primary care provider, they know your medical history and they know that you would be indicated to receive that third dose. And then you sign an attestation document saying that I hereby attest that I am eligible for this third dose and I'm ready to receive it. And then you're able to get that third dose of Pfizer or Moderna either at one of our clinics or out in the community at a pharmacy or a primary care provider's office. Next slide. So here are the locations that we're aware of, in addition to perhaps your clinic or your primary care provider, where you can go in Boone County to receive a third dose. Information as far as how those clinics are running or what you need to do to get an appointment is listed on the screen. Our department has a COVID-19 information line and email address, which is another helpful source of information for all of you listening if you do have questions or concerns. I'll pop that in the chat here in a minute. I also know it's on a later slide in our slide deck, which you'll have access to as well. Next slide. All right, so now let's talk about the booster. Now that we've talked a little bit about the third doses, which we've been doing since the end of August, as I mentioned, we're so excited to roll out our third dose process. We put a big blast out yesterday, now that we have the go-ahead from the CDC and the Illinois Department of Public Health to begin our process here locally. And our first clinics will take place next week. We began taking appointments yesterday and we had an overwhelming response from the community. Very exciting. We were able to make hundreds of appointments yesterday for some of our first clinics coming up, and I'll be sharing more details about that here very soon. So who can get that booster shot? So this right now is for individuals who received Pfizer only. And as I mentioned, data is expected to be submitted soon to the FDA, and it will be reviewed by the CDC's ACIP committee. That's their committee that looks at all vaccinations, not only under pandemic times, but all childhood and adult immunizations that are currently administered in the United States. And they will let us know when Moderna is authorized for boosters as well as Johnson & Johnson. So when can someone receive it? I know that this has been a little bit of a moving target. You all have perhaps heard in the media different speculations as to when we thought that booster dose needed to be administered. I want to clarify a little bit about why that is a moving target. So COVID-19 is a ever-changing virus, right? It's a novel virus. It's something that we're new to dealing with, and it continues to grow and change. We're seeing variant strains, as many of you are well aware of. And so sometimes we begin the research process and we begin to think that we've figured out exactly when that immunity is waning and what we need to do. And by we, I mean our scientists, our experts, our data analysts, our laboratory technicians, the folks behind the scene that have literally been studying viruses within the SARS family for 20 plus years at this point. They have a really good grasp on what they need to be doing. Viruses are smart, so sometimes they morph and change. So I know that this number has changed as far as how many months, but we are very confident now in hearing the FDA ruling and speaking with our CDC and our IDPH partners that that dose is to be administered at least 6 months after the second dose of the Pfizer BioNTech vaccine that was received by the individual. So this was a change from the anticipated 8-month timeframe. So after continuing to do that important research, it was determined that some individuals that are indicated for a booster dose were seeing waning immunity before that eight-month mark. So we really want to boost up our community members' immune systems by starting exactly when the FDA says it's indicated. Now, that means that if you aren't ready right at 6 months after, but you decide 7 months, 8 months, 9 months, 10 months, that's okay. You can still contact us or contact one of our healthcare provider partners, and we would be more than happy to give you a booster dose. This is just the minimum requirement is at least 6 months. Next slide. All right, so the CDC is recommending that the following groups receive the booster shots. 65 years and older and residents in long-term care settings should receive a booster shot of Pfizer BioNTech's COVID-19 vaccine at least 6 months after their Pfizer BioNTech primary series. So after that second dose. Now, there may be some people that are listening in that have only gotten one of their Pfizer doses. That's okay. You can still get a second dose, and then you may still be eligible for a booster at a later time. It's never too late to finish your series of COVID-19 vaccine. Any way in which our department can help you to be fully protected and better protected against the COVID-19 virus, we are happy to accommodate you. The next category of individuals that should get the booster are 0 to 64 years with underlying medical conditions. These individuals should receive a booster shot of the Pfizer BioNTech's COVID-19 vaccine at least 6 months after their Pfizer BioNTech primary series. Next slide. Individuals that are 18 to 49 years old with underlying medical conditions may receive a booster shot of Pfizer BioNTech's COVID-19 vaccine at least 6 months after their Pfizer BioNTech primary series. And then individuals who are 18 to 64 who are at increased risk for COVID-19 exposure and transmission due to occupational or institutional setting may receive a booster shot of Pfizer BioNTech's COVID-19 vaccine at least 6 months after their Pfizer BioNTech primary series. So on this slide, the big difference in the wording is may. So there are some clarifications on the CDC's website, and I'll make sure that you all have access to that link either in the chat or following this presentation as a follow-up if you signed up for the Forward Forum. And the CDC has a nice list of individuals that they feel are working in high-risk occupational settings where a booster dose may be indicated, or individuals who are 18 to 49 who have a list of underlying medical conditions that may indeed put them at increased risk for waning immunity. We'll make sure that you have a better understanding of exactly who those folks might be. But this can be many other immunocompromised states that reach far beyond the individuals that are receiving those third doses. This is a much larger population of people within our community. Next slide.
Amanda, This is Ellen. Could we please go back 2 slides, Heather? Emily and I just noticed that we had a typo on this slide. So that second one is 18 to 64 with underlying medical conditions. And completely apologize for that. I think Amanda said it right, but it is wrong on the slide. So just wanted to clarify that for anyone, because Pfizer is of course not approved for that younger age group. So sorry, just wanted to clarify that in case that stuck out to anybody else.
Nice catch, Ellen. We'll make sure that that gets tweaked in the materials that go out to individuals after the Forward Forum. So yes, we're talking about individuals that are 18 or older at this time. So there are no minors at this point that have been approved. Anybody under the age of 18 is not approved for a booster dose at this time. So the booster dose rollout in Boone County. So we have 4 clinics scheduled for the month of October, and we will be up at the Poplar Grove District 3 Fire Station, which is where we have held a lot of our clinics in the past. And those clinic dates are the 7th, 14th, 21st, and 28th of October. And attached in here is the link to register for an appointment. If you need assistance over the phone, if it is a barrier for you to make an appointment by using the internet, you don't have access to a computer, or you feel more comfortable over the phone, our department is taking calls on our COVID information line, and our Keenage Center partners are also taking calls at their facility. So those numbers are listed here. Other options for receiving a booster dose are to contact your local, or contact your healthcare provider, or visit vaccines.gov to find a nearby location. The majority of vaccine providers are now offering boosters since we've been authorized to do so. So the booster dose is widely available throughout this area. So if the dates we're standing up clinics do not work for you, never fear. There are many, many locations where we can assist you in getting an appointment so you can get that booster dose, or knowing when their walk-in clinics are happening. Next slide. Great. And then there are some mobile clinics that are deployed across the county to not only give first and one and done doses of Johnson & Johnson for community members free of charge, but they're also in the month of October going to begin carrying stock of Pfizer so that they could give you a booster if you went to one of these dates and times that are listed on this slide. Again, for other vaccine locations near you, there is a link embedded here in this PowerPoint presentation to assist you. Our COVID-19 information line is listed on this slide as well, 547-8561, and then our email for COVID information is covid19@boonehealth.org. I will be putting both of those in the chat if that's an easier way for people to access that information as well. Next slide. All right, so I know that different counties are rolling out their process differently. Some counties received more Pfizer than Moderna and vice versa. So booster shots may be available in different counties depending on what population they're serving, who received what brand when the initial rollout took place, the capacity that their local health department has, the types of clinics that are open and available in their area, whether they have a hospital or not within their jurisdiction. So it's going to look different across the state of Illinois, but the booster shot is widely available. So if there's not one near you, if you're listening in and you're in a different county, we're able to vaccinate you at our clinic or vice versa. There's no county level definitions as there was with the initial rollout, where we were only able to start by vaccinating Boone County residents. So please let us know if you need to be vaccinated at one of our clinics because it's convenient for you, but you reside in another county, that's okay. So do check with your local healthcare system, pharmacy, or health department for information on how you can receive the booster shot. Next slide. All right, so we have come to the question and answer section of our panel time, and my experts are on the line here with me, Ellen and Emily, and I'm going to turn it back over to Pam to facilitate Q&A. Pam, thanks so much.
You're welcome. Thank you. It was very thorough and very informative, but I do know we have some questions. Just a reminder to our attendees, please enter your questions into the chat box and we will address them in order. And the first, and also it is a reminder also that our presentation is recorded and will be available along with a copy of the slides. So the first question is the Pfizer booster a full dose?
Yes.
It is a full dose. Okay. Are there any side effects that one is to expect outside of what they have, what was expected for the first Pfizer shots?
Oh, that's such a good question. I'm going to take a stab at that, but then I'm going to let my other expert panelists answer too, because we are dividing and conquering these days, trying to keep up with the research and the information that's coming out. It's my understanding that there's not a lot of information available yet about what side effects may look like. I have not heard anything in the studies that I've reviewed that say that it's anything terribly more severe or anything different than what people may or may not have experienced when they received their first and or second dose. Sounds like some people are having mild flu-like feeling symptoms, or achy, a sore arm, a little bit of a headache, some of the symptoms they experienced with the first or second dose. Some people aren't feeling anything, and then a little bit in between. Ellen or Emily, if you want to field that too, please feel free.
No, I agree with everything that you said, Amanda. That's also what I've been seeing. Similar to what maybe they experienced the first time, maybe even similar to what you get when you have a flu shot, which is often that sore arm and, you know, a little bit of malaise.
And the next question is, will a booster, the information be added to someone's CDC card? And I'll just add a follow-up. What if they cannot locate their card, or they misplaced it, or it's not in good condition? How, what should they do?
So we'll add that to your CDC card. We would ask you so kindly to please bring that with you to any of our clinics. If you have misplaced your card, you may contact our office. However, I will say that we are getting lots and lots of inquiries for that. So it is taking some days for us to get back to people, just because of the volume of individuals that are interested in receiving a new card. There is a really nice way to look up your official information online through a site called VaxVerify. And I will put that in the chat as well. So if someone does not have their vaccine card, they can go to vaxverify.org, put in their personal information, and it will pull up your vaccine record. If you do not have your card and you could print that out and bring that to one of our clinics, then we'll be able to take that information as well as the booster that we give you that day and issue you a brand new card with all 3 dates.
Wonderful. If you get the third dose, can you also get the booster? And I'm assuming that this question is regarding Pfizer, because the other ones aren't available yet.
Yes, that is a great question. We were just talking about that earlier today, actually. At this time, no. At this time, if someone has received the third dose of Pfizer because they are severely immunocompromised, we know for sure that the wait time is at least 6 months, but we have not heard whether someone who has received 3 doses in their series will actually be eligible at that 6-month mark to receive a booster or not. However, I would anticipate that more clarification on that will be coming in the coming months. So before you would be possibly due for a booster, we should have that answer for you. Please feel free to reach back out to our department. I would say a couple weeks to a couple months from now and just check in. And I would guess that we would have more information from the FDA on that at that time.
Thank you. The next question is, who is the pharmacy or medical personnel administering the injection? With the first couple of doses, there were various people from Myers, from the health department, from other healthcare providers that were administering it. Who will be administering the next round, either the third dose or the booster?
That's a great question. So we will have Boone County Health Department staff, and we will have some of our regional nursing school partners participating in the mass vaccination rollout this time around.
This is the time of year where a lot of people are getting flu shots as well. Does this affect their time frame and whether or not they should do the flu shot at the same time, or should they wait for the flu shot? What do you suggest?
Actually, the COVID-19 vaccine has been approved to be administered in conjunction with any and all other vaccinations. So if someone wanted to get their booster dose and their flu shot on the same day because they're visiting their healthcare provider, or they're going to their local pharmacy they happen to be picking up a prescription, and Walgreens has the Pfizer and the seasonal flu shot, then by all means make it a one-stop shopping day.
And I would maybe clarify that at our clinics in October, we will not be doing flu at the same time. We could, it's perfectly acceptable. That is just not something we will be doing.
Wonderful. And one last question that I have is, you know, a number of people have maybe not qualify for the third dose right now. They might not be immune compromised, but maybe they have an upcoming situation where they may be going into surgery over the next month and they want to be cautious and get the shot now. What do you recommend, and do they qualify?
That's a great question. So like I mentioned, I want to pop into the chat the link to the CDC website where it clarifies all the medical conditions that fit in the category that is indicated for a booster at this time. If you don't fall into one of those categories, then I would strongly encourage you to consult with your healthcare provider, since everybody's medical situation is a little different. In talking with your doctor or your nurse practitioner, they'll be able to look at your specific history. If you do have an upcoming surgery or you are getting ready to go into some form of treatment that may put you in an immunocompromised state, then together with your healthcare provider, you'll be able to make that decision as to whether that booster dose is indicated to you at this time.
I don't see any additional questions. Are there information that the Boone County Health Department would like to add that maybe somebody didn't address?
I didn't have anything else. Ellen or Emily, did you? I'm just posting in the chat the VaxVerify link, and then I'm going to post the link for the CDC's list of individuals that fit into the categories for the booster.
I don't think I had anything to add. We have had a lot of calls here trying to help people make their appointments. So please be patient with us. We will absolutely get to you. We have lots of appointments available. We opened up over 2,000 appointments within those 4 days. So never fear, there will be an appointment for you, and we'll be happy to help you do that. But if you're tech savvy, the best thing to do would be to go to our link, make that appointment yourself. Be sure that you bring that ticket with you, either on your phone, which a lot of people do. We're used to doing that with lots of other things. And maybe just mention, I think we've had a couple of questions about, I laminated my card. Now what do I do to have you guys put my my booster dose, my information on there? We probably will have to just issue you a new card where we'll put that third dose on there. So be sure that be sure you bring your card though. It will definitely speed the clinic up if everybody has everything that they need in their hand as they come through the door. So we appreciate that. If you've lost it, as Amanda said, it takes a little bit. So please let us know right away, or go to that VaxVerify, print your record out, and then when you get to the clinic, you won't have to look anything up. Your information will be right there. We'll quickly fill out your card and get you on your way.
Well, at the last clinics, you relied on a lot of volunteers for support. Are you still looking for volunteers as you move forward?
We are always looking for volunteers. Yes, everybody that's on this call probably knows your local health department is small and mighty. We can't do it without our volunteers. As Amanda mentioned, we will have some of our nursing school partners with us on clinic days. We also think we may have some pharmacy students, pharmacy schools on board with us as well. The support from the community, the Keen Age Center in particular, has also been great helping us, especially with the 65 and over population. So they will be helping us a little bit on our October clinics. We will have some wheelchairs available up there. So for this population, that's sometimes something that is really important. So anything you need, we can do. If you want to volunteer, please call us and we'll get you on our volunteer list.
Wonderful. Well, Amanda, Emily, and Ellen, I want to thank you all for being such wonderful guests and panelists today. It's been very informative, and we appreciate, and as Amanda said, give kudos to all of you and all the work that you do. Just reported today, we're over 50% vaccination rate, which is just fantastic news. The point is to keep everyone healthy and keep our businesses open. Congratulations. Yes, thank you. Congratulations on your efforts. We all appreciate the work that you do. And I want to thank all of our attendees for joining us today. And again, if you have further questions, if we can go to the next slide, if you can please contact the Boone County Health Department or email the Boone County Health Department, or you can go to the Forward Boone, and those links will be available for you as well.
Pam, if I may, I see one more question in the chat that, not to derail your ending here, but I think it's a really great question. Susan, thank you for asking it. What did the Pfizer research show that indicated that the booster is necessary or effective? That's such an awesome question. So there's two key things that I've been reading about in my role as a public health professional, as the leader of this county's health department, that I think are extremely important that we've been watching with the research. So one thing we've been watching is waning immunity, and it's very similar to how the process has evolved over the decades with the development of our seasonal influenza vaccine. So influenza is a virus, not in the same family as COVID-19, but behaves in a similar fashion where it morphs and changes. People's immunity wanes over time, and that is why with influenza, we need to receive a seasonal shot every fall here in this country. And then in the other half of the hemisphere, they need a shot at the other half of the year, right? Because flu circulates the world depending on the climates and the shifts in the weather patterns, and also based a lot on international travel. So COVID-19 has begun to behave very similarly. And so we're watching it very closely, watching how people's immunity has waned over time, especially individuals who are in higher risk categories. If they have a weakened immune system, we are now seeing, because of the studies and research, that their immunity is waning quicker and that their immunity is holding on for a shorter time span. So I can give you a few other examples of vaccines that we've had in place for decades that we need a booster shot of in order to protect ourselves. So for example, the pertussis vaccine, which is something that young children receive. When they enter into adolescence and they go into middle school, they need a booster shot of that. And then again in high school. And the reason for that is because we've done research over the decades to show that their immunity wanes enough that to keep them safe, that they will need an extra dose. So we're already able to determine that our 65 and olders and that our immunocompromised individuals are needing an extra boost to their system. And that is the reason why Pfizer has recommended, based on their research, and the FDA and the CDC and the Illinois Department of Public Health have gone ahead and approved this. It is showing that it is extremely effective. It remains to be seen, because we are living history, we are writing history as it's happening. Remains to be seen what will happen after this round of boosters. Who else will need a booster? How long will that booster immunity work for us? We're writing the history books as we go here. I feel real confident in the work that's being done in these research labs and in these clinical trials. Some of the most world-renowned scientists and researchers who have been studying SARS viruses, which is what the COVID-19 virus is. It's a member of the SARS family. They've been studying this family of vaccines and viruses for decades. So they're able to really make very good predictions on what will be necessary.
Thank you. Very thought-provoking question. And as you're aware, we, as that intelligence comes through, the Boone County Health Department has been, again, providing that information through forward forums and information forums. So we have the most educated decisions and information that we possibly can at our disposal. So thank you very much for addressing that, Amanda. And again, thank you to the Health Department for your presentation and addressing some of the questions that our communities had. And again, some questions may come up as you move forward or as circumstances change. Please feel free to contact the Boone County Health Department at 815-547-8561 or email them at covid19@boonecountyhealth.org. And if you don't recall, just go to Boone County, Forward Boone County, and those links will be made available to you. So again, thank you for joining us. And again, everyone, thank you for your time. Be safe.